Tonight, we are in the middle of Lung Cancer Awareness Month. Christ Hospital wants to get the word out about screenings and treatments because early detection can result in better outcomes. They're hosting a free webinar Monday afternoon to help answer all of your questions. And here with more information is Dr. Brittany Bell Gordon. She's a medical oncologist with the Christ Hospital Network. Thanks so much, Dr. Gordon, for being here with us.
Thank you for having me.
Well, we appreciate it because we know how important this is. In fact, Ohio and Kentucky have some of the highest rates of smoking in the country. So I guess my question first for you is, what should people know about the risks of developing lung cancer?
So smoking is actually the first risk for actually developing lung cancer, and it's actually linked to 80 to 90% of lung cancer deaths. Additionally, with smoking, the more you smoke is the more risk you have of developing lung cancer. But we do have the screening that would be able to check if you have early detection of lung cancer so that we can treat you so you have better results or better outcomes from the disease.
And we know smoking obviously is one of the big ones. Who else should be screened for lung cancer?
So anyone that uses tobacco products, so if you're cigars, if you're vaping sometimes, but the issue is that we don't have that much information about vaping, but we do know that the chemicals that are in vaping it's not a field that is actually well orchestrated. So the chemicals vary differently, even per product and even per company. So it really puts you at risk when you're vaping and doing other tobacco products to actually develop lung cancer, but we don't know the actual risks like cigarette smoking.
As the parent of teenagers and college students, scares me to death because I see, them, their friends, and that, and especially at the college level where, they all have these vapes in their hands. Talk to us a little bit about the screening process. What does it look like, and how long does maybe a test take?
So the screening process is very fast. It takes less than 1 minute. And it's actually a low radiation dose chest CT. And they look for any masses or any concerning signs of lung cancer. And you can get it from your primary care provider. You can tell them how much you smoked, and they can see if you meet the criteria to actually be screened for lung cancer. The Christ Hospital also has a lung cancer screening clinic where we also have patients self-refer, as well as primary care providers self-refer their patients there in order to screen them for lung cancer.
And Monday, you guys are having a webinar. Talk to us about that and what people can expect to learn.
So at the webinar, it will be myself, who's a medical oncologist. We are also going to have a CT surgeon, as well as a pulmonologist. So we're going to discuss about the actual screening, the diagnosis, the treatment, as well as our relationship with the Dana-Farber Institute.
And we know that, lung cancer 10, 20 years ago used to be much scarier than what it is now. Talk about just how far we've come in lung cancer treatments, maybe giving people hope.
Yeah, so with lung cancer treatment, we primarily do surgery, and then we also do radiation. In the medical therapy, we have chemotherapy, targeted therapy. So this is actually therapy where the cancer has a mutation that causes the cancer to grow, and we have therapies that direct that mutation and help to treat patients. And that's typically an oral pill, so that's pretty easy for persons to tolerate, as well as we have immunotherapy, where the actual immune system helps to kill the cancer. And we use these different combinations in order to get the best outcomes for our patients. At the Christ Hospital, we also have a lot of clinical trials for patients that have progressed through all these lines of therapy, and we're able to give them better outcomes or extend their lives and allow them to live well with their family.
Yeah. All right, Dr. Brittany Bell Gordon, thanks so much for being here and sharing that knowledge.
Just a wealth of information and so important. All right, so again, the webinar happening on Monday from noon until 1 in the afternoon, totally free. You can register at thechristhospital.com/lung-webinar. We're going to have that link for you, by the way, on our website, WLWT.com. Doctor, again, thank you so much for being here.